The ability to see is a gift that not all who lose it are able to regain. But one man, Benson Wenjao, popularly known as Mzee Ojwang, can count himself among the lucky few. Ojwang recovered the use of his left eye after undergoing a successful surgery at the Lion's Eye Hospital in Loresho.
Kuna wale wamenisaidia, kuna wale wameniombea, wote. Mungu awabariki. Hallelujah.
Nakwambia mbuyu, tuko very grateful kwa unacheza ligi so.
Hata msee mimi kwa baba amekuja kuangalia. Anafurahia sana wewe uko mzuri kabisa.
Behind this face, the man who for the last 40 years kept Kenyans laughing is a sad man.
Ninakwambia ugonjwa ama uzee si ugonjwa.
A man struggling to keep a smile on his face as he battles feelings of depression.
Aliingilia kinywaji simu kwa mapenzi yake, nilikuwa na depression.
Wakati ule ilifika sasa wamesimamisha hiyo vipindi yao. Sasa ndio hapo alianza kusahau.
With these kind of symptoms, Mzee Ojwang is now expected to spend some time at the Nairobi hospital to undergo a psychiatric examination. Mzee Ojwang represents a growing number of Kenyans who may or may not know if they are depressed. But how would you know if you are depressed? And is depression associated with madness?
Madness is a term which we no longer use. We talk about mental illnesses and mental health problems. So depression is one of the mental illnesses.
The normal ups and downs of life mean that everyone feels sad from time to time. Depression, according to Dr. Mutisia, is much more than feeling sad.
It has to be severe enough to affect your social life and your career or educational life.
Depression can be manifest in both the physical and mental state. For one to determine whether they may be depressed, these are some of the symptoms to look out for.
The person feels sad most of the day, and this is not the normal day disappointments. It can go on for like a week.
Other mental symptoms include a feeling of hopelessness and helplessness, feelings of guilt over happenings they aren't entirely responsible for, a loss of control over negative thoughts, and irritability. The physical symptoms may manifest themselves in a loss or increase in appetite, loss of interest in things one once enjoyed, a loss of interest in work, excessive sleep or lack of it altogether, a loss of libido for those who are married, and a possible engagement in reckless behavior like overuse of alcohol. If you suspect you could be depressed or know someone who may be exhibiting these symptoms, Dr. Mutisia has a word of advice.
It would be good to visit your doctor. And it would be better to be checked and you're told, no, you are normal, this is normal, than to just sit at home and let the symptoms worsen.
It is said that information is power and the ignorant perish for lack of it. As Kenyans, we continue praying and contributing to help restore the laugh and smile back to Mzee Ojwang so that he can go back to tickling the ribs of many other Kenyans. Joy Kiruki, K24.